welcome everyone. It's such a delight to see all of you. My name is Vishwanath. I'm the director for the Lee Kum-Shung Center for Health and Happiness at Harvard Chan. I'm a professor of Lee Kum-Ki Professor of Health Communications here at Harvard Chan and the Dana-Farber Cancer Institute. As you know, we have been holding, these are monthly seminars and webinars we hold. Though this year's theme is isolation and happiness, last year we had a seminar, a series of seminars, and the theme was on social media and happiness. And we wanted to bring Dr. Williams last year as a speaker, and also for another workshop we were holding. So I have been trying to get you for years now, so because her work is so unique and so unusual, because not many people in the country are doing the kind of work she's doing. So it's a delight to have you here. At least now we can get you here. Kind of a fate intervened, there was a blizzard one time, COVID, and so on and so forth. By this time you know who Dr. Williams is, but just for introductions, she's a faculty member in the Don Sife School of Public Health at Drexel University. She has a varieties of, she's a social and behavioral scientist with a strong program of research, but there is one component of her research program which is particularly critical and germane to the conversation here. So she investigates the role of social media and digital technologies in improving mental health symptoms and mental health care access among those who are traditionally excluded. So remember, we have talked about in the past on data absenteeism, the absence of data from important and critical groups, but Dr. Williams is one of the few people in the country who are actually looking at people who are excluded. It's an area of work that converges to lay the foundation for a future intervention work and inform the best practices and approaches for developing digital mental health interventions. So as you know, the theme of the mission of the center is not about negative health, but positive health, right? And I think, some mental well-being is very critical in addition to social well-being, which is one of the themes we have been focusing on, and her work is very much relevant to that kind of a positive approach. Do something, and we know that there is a problem. So thank you for coming, welcome. I also want to welcome those who are on Zoom and people in the room. So, thank you.
It's on. Yeah, perfect. Okay. So, yes, everybody, hello. Thank you, Dr. Vishwanath, for having me. And I'm excited I'm finally able to make it and grateful to have this space to share with you guys and to those on Zoom. Hello. So I know that everybody is eating, and I know it's like lunchtime. I think about, teaching and how my students typically get the itis at this time of the day, and so it does not discriminate. So if anybody feels like they need to step out and take a break, stretch or whatnot, I invite you. But also, I also invite you to kind of sit and think about the fact that I will be talking about some stuff that is deep and heavy a bit. So if you need to step out, take a time to check in on somebody, check in on yourself, or check in with your seat, I'm welcome that wholeheartedly. And so I like to start conversations like this and talks like this with a statement that I say out loud, which goes like this. Hi, I'm Dr. Kofoworola D, and I'm a guest in this space. So not only literally physically as I stand here with you guys right now as a visiting faculty member from another institution, but as a Black, heterosexual, able-bodied woman in this particular space of work. I'm a guest to the Black men who I work with, the Black men in my life, the Black men who I will work with. And so I stand here in honor of that to share with you what I've been permitted to share with you, what I've learned, what I want to learn, and what I will learn, and just giving you guys and share you guys my passion. And so some Black men in my life. So this slide right here, as you can see, has titles of articles that I come by daily in my work, articles that some of you may or may not have seen that speak to a specific mental health crisis in which certain populations are at the center. And so I'm about to, throw up some statistics. It'll be about 6 statistics that I will not be reading out loud. give you this opportunity kind of to sit and ground yourself in the presentation. And so it's 6, so I'll start now with the first statistic. Second. Third. Fourth. Fifth. And sixth. So as you're looking at the last statistic, this is obviously a reality. There's statistics, there's statistical evidence by institutions like the CDC, Office of Minority Health, and so on and so forth. But when I see these statistics, I see the black men in my life, the black men I work with, and it's really disheartening. And really, this is a signal for a call to action that is put forward by many public health researchers within this space, and that we all really need to take seriously. According to Adams and Thorpe, they put out a call to action in 2023 saying that the suicide prevention field has often overlooked black males, which is concerning, as according to people in this field who do work in this area, like Watkins and colleagues, Daphne C. Watkins from University of Michigan, black men are continuously targeted by systems of power, oppression, and inequities that increase their risk of poor mental health. It is important, again, as Adams and Thorpe say, that we lift up work and approaches that incorporate diverse perspectives of black males in order to create prevention efforts that promote equity. And specifically within my work, I focus more so on black men in college. So what the literature says, what some of my work says, is that black men in college are at increased risk of experiencing poor mental health due to a myriad of social and ecological stressors. Gender stressors, conformity to social constructions of masculinity, college stressors. We all remember what it was like to go to college and to be away from family and trying to figure out our own selves. Stresses associated with emerging adulthood. The transition from adolescence to adulthood can be very jarring. I know it was, especially for me. Racism and racial discrimination. And importantly, I want to point out there are a lot of stressors that are rooted in racism and racial discrimination, other social inequities. Vicarious racism are one of those forms that kind of were publicly highly mediatized during the pandemic, so that lends itself to police brutality, all the videos we saw at some point. Childhood trauma is still a continuous factor. Unhealthy behaviors, imposter syndrome, stereotype threat. So in the literature, there's evidence that suggests that some black males on college campuses feel like they're a walking stereotype and are also afraid to just kind of be in certain spaces because they don't want people to see them as a stereotype, and they also don't want to be seen as a stereotype. And so that also lends itself to increased risk of mental health symptoms. And so comorbidities are like outcomes. So comorbidity with anxiety, chronic illnesses like cardiovascular disease, which black men are disproportionately impacted by, impacted performance, which is important to point out, as education is the social determinant of health. And especially in a lot of institutions, we know that black men are less likely to enroll, more likely to drop out, and retention rates for this particular population is low. And so overall, it's a diminished ability to engage fully as full members of society in the communities they work in, the communities they're lifted up in. It could be very difficult dealing with these symptoms. So at this point, I was also, this is like where I'm talking about my back in the day days when I was a PhD student, and I was focusing as a social and behavioral PhD student on help-seeking behavior. So those same stressors and factors that I mentioned that increases their risk also, for lack of better terms, transforms as barriers to seeking help, their willingness to engage in help, their less likelihood to seek help. And so also what I noticed when I was, being a concerned PhD student working on my work, there's actually limited quantitative and qualitative evidence that describes mental health experiences for black men on college campuses, especially depression and anxiety, and which is concerning as those are the most common mental health illnesses. So I conducted studies for my dissertation work that were, 3 connected studies that focused on what exactly are the rates of depressive symptoms and anxiety symptoms on a college campus, what is impacting this risk, what is influencing their resource seeking, And so here are 3 or 4 papers that have come out from this work. It's a packed slide, so bear with me. I'll just put everything up right now. And so the aim overall of this study was a mixed method approach grounded in a social ecological model. So what individual, interpersonal, community, societal level factors are influencing their risk of experiencing depression symptoms, anxiety symptoms, and then also impacting their willingness and their likelihood of seeking help. So what I did find from this study, from the secondary data analysis specifically, is that, in fact, Black male students on this particular college campus, and I'll leave out names for confidentiality reasons, is that 58% of the Black male population, around a sample of 500 or so Black male students, 58% were experiencing at least one anxiety symptom. 84.5% were experiencing at least one depressive symptom, and I will make a note that depressive symptoms among the student population compared to white male peers, white women peers, and Black women peers were pretty high for them, but still important to note that there is 84.5% of that student population. Still, despite this experiences with depression and anxiety, they're seeking counseling services less than their white male counterparts. Factors include stress, financial status, and cannabis use, which was significantly positively associated with their risk. Religiosity, which aligns with literature, was associated with lower experiences with anxiety and depression. And then I also had the opportunity to talk to men. I did focus groups with about 20 men, mostly juniors, and they were so grateful to have this space and so very open. I'm forever grateful to them, and they just talked about their mental health experiences. One student talked about how, the potential reasons why they would seek help, because we're interested in facilitators, we're interested in barriers, especially when we're trying to create things. But an individual talked about how they actually had experience with an attempted suicide. And so because of that particular experience, they're likely to seek help. But also keep in mind that there are still individuals who are not necessarily attempting suicide or who are not necessarily at that level, and they also have reasons for not seeking help. Those include trust, engaging with therapists that ultimately do not look like them, and they will tell me straight up that they're not going to know what I'm going through. I'm a Black male on this campus, they're a white woman, they're not going to know what I'm going through. And so there were more so reasons like this. And this experience is very important for future work as I think about interventions that I plan to develop. So from this particular study and approach, the biggest thing that came from it was Black males, even on the college campus, in a controlled environment, in a silo, where they have access to resources. They know where the resources are. Like this particular population, they knew where the resources are. They know where the counseling services are. They know how many sessions they're going to get, which is actually also a barrier because they don't think 5 sessions, for example, is enough to get to the root of my issue as a Black male on this campus, as a Black male in society. But they had all this support and care, right? Well, they still need our support because ultimately they are not accessing these services for a host of reasons. And so it's critical and important that we explore other avenues and promote access, avenues that specifically promote access. And so I actually want to take this moment to reaffirm access in the meeting. And really, this was just me consulting Merriam-Webster, dictionary.com, to kind of, think about the basic definition of access. What does access mean? So as a noun, access is a means of approaching, freedom or ability to obtain or make use of something. As a verb, access means to be able to use, enter, or get near. So think about that for a second. So with this in mind, for me specific, I'm like, the access is not there. Current mental health resources, a lot of mental health resources programming do not have, are not meeting these men's preferences for how they want to seek and receive support. They're not culturally relevant. They do not see themselves in these programs. They're not created alongside and in development with the population, so things are going to be missing naturally. And they do not address factors that impact uptake of certain tools of these mental health programs, and also they do not address factors that are barriers to delivery, some of which I've already spoken about. So services and support should not only be effective, but need to include different modalities that Black males are interested in using or that they're preferring. And so digital mental health interventions, which I'm super stoked about, show great promise in this area and provide an ideal platform for delivering mental health support via different modalities. And so I'm going to talk a little bit about why a digital approach, why I'm so stoked about it, what we're hearing about digital mental health interventions in the literature. So overall, there's evidence in literature to suggest, specifically for minority populations, that GMHIs are addressing health disparities, They're promoting health equity. They're typically low cost, cheaper alternatives, cheaper complements to other therapy services, promote connection, and also have been used successfully to recruit a lot of individuals from traditionally excluded populations into mental health work. They're effective in reducing mental health symptoms among young adults and college students, especially those experiencing anxiety and depression, according to Cruzan and Laddie and colleagues. And they promote increased accessibility, convenience, and decreased stress for clinicians. So this last one is important because, as we saw in the pandemic, there was a shift in perspective. There's a shift in need and demand where things went remote. We needed more digital ways to access support and so on and so forth like that, especially on a college campus. Digital mental health interventions utilize relevant tools and technologies. So the digital environment is not going anywhere. Social media is not going anywhere. The need to have these services on digital-based platforms is just going to keep growing. As we see here, it's just a quick graph where we can see what groups are using mobile technology. Among Black individuals specifically, 83% of Black individuals own a smartphone, 84% are on at least one social media site, and 65% of Black individuals use these platforms daily. Particularly U.S. men, 85% own a smartphone. Young adults, 96% own a smartphone. 80% are at least on one site. And so why not figure out ways to, meet people where they are, promote these services and tools that they're already using. And social media is super powerful. There is the debate that is negative. There is a debate that is positive. I center and hover over the positive side and the positivity side, as I know it connects a lot of individuals to other communities. If we think about other traditionally excluded populations, like those that identify with the LGBTQIA+ communities, their only supports are on social media. They can't access it anywhere else. Social media has been instrumental in a lot of social movements that we see today that are impacting traditionally excluded populations. And so I stick with social media, the positive side, and figured out the best ways to use that in digital mental health work specifically. So my hand in this was actually this study where I was looking at social media, particularly features like hashtags, and how to use it as a digital tool and how to kind of think about how we can use it in future work. So I did a content analysis with colleagues during my PhD into postdoc, kind of, sort of, and it was looking at these particular hashtags, Black will join, the Black man can. And the aim of this study was to analyze how these posts on social media, among 500 posts, what they're including, how they're countering narratives, negative narratives and stereotypes that are often placed on Black men. So narratives like Black men are uneducated, Black men are criminals, they're thugs, they don't deserve to be a part of society. Real ridiculous, I almost cussed. Real ridiculous stuff. But so I was so excited to kind of figure out how are we countering those narratives and how can we lift up these men as a means of positive affect for their mental health needs and concerns. So here's what some of the posts look like. And so from this, we see images of Black men, Black male doctors, educated, Black men who are with their peers, Black men who are engaging in what people might call atypical gender behavior, the stereotype that Black men are, don't want to be fathers, they run away from that responsibility. We had a lot of images of Black men engaging with picking their children up, doing their hair, painting this view that they are instrumental members of society. And lifting up and expressing and celebrating these Black men. And so with this in mind, I kind of keep the findings from this study with me as I'm thinking about certain components to co-design and co-create with individuals and how can we manipulate that kind of positive affect in a digital-based or social media-based intervention. So digital mental health interventions are human-centered. So typically a lot of digital mental health interventions are designed under the framework human-centered design, which includes a host of approaches, methodologies that requires you place potential users and relevant stakeholders at the center of the design process, and not only at the center, from beginning to end. And so as they're included in the decisions we're making and how they want to be supported, digital mental health interventions are human-centered, safe. They're made to better understand the needs of people who you aim to be served, and they ultimately promote access and usefulness and equitable care. Unfortunately, very few digital mental health interventions have been designed using human-centered design principles, specifically with Black men. So they're not included in these processes. They're not included in the mental health support that they want to receive, how they might want to receive it. And so therefore they fall short in a few areas. The mental health support, the digital mental health interventions that are effective, how effective are they for Black male populations, other traditionally excluded populations, especially when we take kind of the approach with certain interventions that we have that are effective, we want to adapt it as opposed to going back to the drawing board and creating these tools and programs specifically for them and with them. And so they fail to mitigate disparities, their mental health risk, and access. So at this point in the talk, I'm moving to talk about how I kind of took a step back looking at my, postdoc work, my PhD work, the content analysis I just mentioned to you all, and looking at it from this human-centered design framework. And so this is typically the path that is followed when you're designing human-centered design methodologies, or rather technology. So empathy phase is there. You're understanding the problem. You're engaged with communities to understand the issues. So within my case, is Black male students, what their mental health experiences are, how it's being exacerbated, what's not working, what's working, what do you want, defining the context. Social factors are extremely important. You don't want to create tools that is going to be a barrier in itself in using. The ideation phase, which is brainstorming, and then prototyping, so constantly iterating solutions from low fidelity prototypes, which is something as simple as a piece of paper or going to a draw board and sketching some images or whatnot that would eventually at some point with feedback and testing develop into high fidelity prototypes. So right now with the work that I've mentioned to you all, I kind of hovered with that in the empathy and define phase. And so these are some considerations for my PhD work and then the hashtag work. So I kind of got a sense of what stressors would be important to focus on. You can't focus on everything in one intervention. Like, that's just kind of robust, and you want to make sure it's effective. So you want to choose intervention targets and certain targets that are most relevant to focus on, in the time. So address stressors such as financial stress, masculine norms, workload among Black male students, symptom management. And here I'll make a note that there's a lot of mixed evidence in the literature on how certain depressive symptoms and anxiety symptoms present and manifest among Black males, which leads to a whole bunch of issues that I won't get into right now. But in the study, I was able to talk to men about what do you think your symptoms look like? How do we need to address that? It's important to create peer support opportunities to connect other Black men who are experiencing mental health issues with other Black men who need help in that area, strategies to combat stigma, and provision of social support. So with that, I now, in my recent work, moved into the brainstorming phase, but still holding on to the empathy and define phase. So this particular study that I'm about to talk about, again, is mixed method. The quantitative analyses or results are not yet published, so don't go snapping and stuff. But it was a secondary data analysis. I had access to a data set for student population where I did my PhD, and so it had social media questions, questions around help seeking, what platforms are they interested in using, what are they using it for? Are they using it for social support, health information seeking? Analyses were conducted for college students between 18 and 25 who endorsed at least one anxiety symptom or one depression symptom. And so the results are descriptive and exploratory, so I look forward to expanding on it. But YouTube and Twitter were popular platforms, particularly among this Black male student population, so that would be a great avenue moving forward to focus on a digital-based approach for mental health support on these platforms. Particularly these individuals, 61% of them were using YouTube generally. 32% were using it specifically to seek social support. 16% were using it to seek health information. This is a little more broad, but it included mental health, sexual health, physical health. Social media use for health information was positively associated with anxiety, which I was particularly curious about. As we know, there's a lot of debate around how social media use impacts symptoms and so on and so forth. Pinterest is not an avenue we want to take with Black males. They are not using this particularly on this population. And I understand it. I'm on Pinterest, and what I be doing on it, But so Snapchat, 75% of the population, particularly on this sample, were using Snapchat just for general use. So the qualitative exploration pertaining to the study was interviews. It was conducted during the pandemic. So I did Zoom interviews with 11 men from 2 universities in Chicago, where I was doing my postdoc at Northwestern. And the aim of this specifically was, you know how people are like, if you build it, they will come, which I don't think is not true. But I think it's important to also look at it from like, you know, if you build it, you need to make sure that it's able to meet them where they are. And so with this particularly, I wanted to know, all right, what are the stress relief strategies you're particularly engaging with? How can tech support you? How can social media support you? How can mobile apps support you? What are things we need to include that makes you want to use it, that allows you to see yourself, or whatever the case may be? And then if we do create this thing, how do we get it to you instead of putting that onus on them to reach out or to grab resources or mental health support that are you okay? Okay, cool. That they will actually use these resources if we make it. How do we get it to them? So here are some quotes from, I'm not going to read it in like totality, but particularly for stress relief strategies. So some male students talked about how they want to feel good from the inside and they want to feel happy, and certain things that they engage in is watching funny videos. A particular student mentioned watching Insecure, which I don't know if you guys remember Insecure. I mean, it wasn't that long ago, but Insecure was great. And so they watched that to boost their mental wellness, for self-care, kind of just to get their mind off things, so a form of distraction. An individual talked about tech support. They want an app, recognizing that social media can be negative. They want an app that is more so healthy social media. So providing them with resources for different activities. Excuse me. We're going to get through this. So different activities like mindfulness activities, self-actualization activities, self-reflection activities, and also a space to connect them with other Black men who look like them, who have experienced what they're experiencing. They wanted things that specifically, you know, this is things that we have seen, that we have kind of aware of as a specific barrier for help seeking is mental health stigma and attitudinal barrier. They want wording and positive messaging that specifically almost gives them permission to, you know, use these services by saying, you know, we want something that doesn't judge us, that, you know, specifically combats stigma, that is comforting, like a student mentioned. And then how can we get the word out to them or to other places? You know, individuals did talk about partnering with influencers on social media, using social media like Instagram and Snapchat, because they know a lot of their friends are on there talking a lot about social issues, whether it's mental health or other parts of our society that are important. So it makes sense to, again, use tools that they're using where they want to see these things. So this study, and so far in my human-centered design journey, is a reaffirmation that access and means of approaching, you know, what Miriam said, is indeed low due to a lack of culturally relevant content, lack of representation, lack of or diminished relatability, not meeting them where they are. But with these this evidence and other work that may be done in this area, we have direction for moving forward and how to create, or what to create rather, and what platform to put it on, what platform not to put it on. And so, from an HCD lens, here are future considerations. This on the left, we've already talked about. So stresses to potentially focus on, things to potentially promote, particularly from this latter study that I mentioned. Increase and provide mental health knowledge that is Black focused. So a lot of Black mental health prevalence and statistics for Black males are typically conflated with the general population, or it's masked within overall Black community statistics, or a lot of some research at some point, you know, focused more so on African American women, African American adolescents, African American older women, and so they want more information that they see themselves in. Promoting relatability, features that they're interested in engaging with, notifications that remind them to engage in stress relief strategies that they said they want to engage in. Visual text-based messages that are inspirational, provide positive support. And so with that in mind, I'm processing this information, working on my next steps, which include this. I need a second. I don't know what's going on. Is it my blazer? Am I hot? But my next steps include prototyping and testing with continued empathy, so still focusing on all the phases within the human-centered design process that are cyclical. Taking what I've learned and seeing how it can extend to other representative samples of other Black male communities. Co-creating and continuous co-designing with this population. I'm actually moving into a phase with some studies where I will be co-creating social media and mental health messages based on previous findings with Black men in co-design workshops and usability testing sessions like that, including evidence-based treatment models. So I'm sure many of us are aware cognitive behavioral therapies are very effective in addressing mental health symptoms or reducing mental health symptoms, depression, anxiety among minority populations. There's evidence to suggest that. How well do those same treatment models work with Black male populations or other traditionally excluded populations? A lot of these approaches were created with white males, white people at the center. How well do those really extend to people who have vastly different experiences that are rooted in institutional and systemic racism? Partnering with the community organizations is important, so I'm working on building relationships in the Philadelphia area. Organizations that are minority serving, Black male serving, Black youth serving, and then inviting relevant stakeholders to the table, which include Black males, but also, we want to be able to, if we create this intervention, that we can implement it in a sustainable way. A lot of interventions that are in this field kind of stop at that last paper that you read where, oh, it's acceptable. We have to keep going past that point. And so that is important to have community stakeholders at the center. So I'm rounding up, guys, and I can't end without talking about the equity issues, challenges, and considerations for this kind of work in this area. So there are current challenges in the field in creating digital mental health interventions. Primarily, digital health interventions are innovative and creative, and we're trying to kind of include that in a traditional landscape that is going to require a lot of organizational and institutional change from intentional and thoughtful researchers in the field that include the diverse perspectives. Evidence suggests, or literature suggests, there's mixed evidence on measurement and reporting of effectiveness for a lot of digital mental health interventions. And so we need to, kind of hone down in that area and figure out, what is making something effective. How do we translate that to other populations? We have to be wary or mindful of the institutional and systemic barriers that implement uptake of digital tools, and also that impact certain populations' ability to access these resources that we're creating, especially resources that they need for their individual well-being. And lastly, particularly in challenges or in this vein, co-design takes time, intervention work takes time, and so it requires a lot of resources. Again, due to certain factors, a lot of communities can go without resources, and so how do we still help those communities? Just because we're saying digital approaches are more effective, they increase access, are they increasing it for everybody who's falling through the cracks? Equity issues. A lot of these digital mental health interventions that I mentioned are designed by people who don't look like the population, white male designers, white male researchers, and so it requires different approaches that have a lens of anti-racism, cultural inclusiveness, teams that are diverse, and we can't run away or shy away from the role of racism, which is super powerful, and so we need equally powerful approaches that calls for dismantling these systems and bringing these resources to people who won't get it otherwise. And lastly, for consideration specifically for human-centered design processes and methodologies, you should be including users, potential users, relevant stakeholders, and community organizations throughout the whole design process, even if at conceptualization. And then establishing teams that are diverse and closely matched to potential users. If that is not the case, the whole team cannot be closely matched, and it's important to practice reflexivity, create iterative processes to examine those processes that you're putting in place to create these tools, almost like a look in the mirror and check yourself, check your attitude at the door. And then important to incorporate methods that complement human-centered design, like participatory action research, applying intersectional lens to this work, anti-racism frameworks, and so on and so forth, to ensure and promote that activities and components within interventions that we're creating will reflect the context and potential users' lived experiences. And y'all still with me? Y'all still with me? Yes. Okay, we're ending. So here are the references. If anybody cares so much to look it up, here are my acknowledgments in form of like, kind of where I've gone since undergrad and where I am today. And here another set of acknowledgments where I take time to acknowledge the Black male students who have participated in my studies, who will participate in my studies, the funding, the money. We can't do this without the money. And then my mentors, family, our accountability partners. And in the spirit of Black History Month, celebrating Black history always, Black researchers who have come before me in this, who have been fighting the fight for a very long time, who I've spoken with, who I've been mentored by, those who I cite. Not an exhaustive list. And then the Scholars Network on Masculinity and the Well-Being of African American Men. And my favorite last slide that I like to end with, thank you guys for listening to me for however long. I was over, Anuba? Okay. So thank you for attending and listening. Here's my contact information. Celebrate Black history always. Thank you.
Can you take some questions?
Yeah.
We have a few minutes.
Any questions? The air was choking me out.
In your research, have you stratified by sort of like first generation versus U.S. born Black men? Are there any differences?
So I have not. There's research that has and that does suggest that certain populations like Caribbean Black males may be at even higher risk. I have had Black male students in my study who are first generation and actually who have talked about how being first generation is actually very stressful for them and impacts their, the feelings they feel when they're down, their anxiousness for different reasons. That sometimes comes in a form of self-pressure and parental pressure, which can impact, their experiences on college campuses. But that is an opportunity for future research and, expanding this work to, more diverse perspectives of Black males because they are not a homogeneous sample. There's a lot of heterogeneity within there. It's very important. And actually speaking that these populations who I have worked with, they have been on certain types of campuses. And so extending to, more PWIs, HBCUs, technical schools that still have these Black male student populations. And also Black men within the community. I do focus on Black college men, but I do in my future work plan to expand out. I'm not only trying to create an intervention for a specific group, I want to help the lot.
Hi, this was a very informative presentation.
Oh, thank you.
I really appreciate it. I was just thinking about the promise zone in West Philadelphia. Do you have plans to sort of extending your findings to that zone specifically because of the proximity to Drexel also?
So as of now, I do not have plans to extend out, but that is something to consider for future work as well. And then I have you next, and then you.
I was just wondering, as who is a young Black college male always changes year by year, and as social media also changes year by year, have you seen anything change in the samples that you've been looking at? And also, have you seen like the demands or needs for social media to do different things change?
It's a good question. It's a messy world, right? So in the study that I did as a postdoc with the two universities from Chicago, I actually had individual Black male students who were undergraduate students and graduate students, 18 to 35. And particularly within that study, there were not too many crazy differences. The overarching themes are still pretty the same. And then the changing landscape for social media, right? That is a good point that I've been thinking about as we saw how Twitter went from Twitter to X and how a lot of individuals, specifically from low-income populations, rely on Twitter for like news and other types of information, especially, is concerning in towards how it changes. But, I think, keeping these men and co-designing with them, they know a lot more about that world than I do. If I'm not using the social media as they are. And so that will be something I'll be learning from them and how social media shows up in their lives and how we can then work with what we have to help that fit seamlessly. Does that answer your question?
Yes.
Cool.
Thank you for the presentation, and you shared that this was specifically for college campuses, and your thoughts are to expand it out.
Mm-hmm.
Have you thought about, there's talks about like
So I have thought about that because I do need to include treatment models in these type of interventions work, right? And so I'm actually working on, this is kind of fresh, but I'm working on submitting a career development application to kind of do more work, more training in that area to figure out how we could take those type of CBT therapies, because they are also effective outside of sessions, and apply it to this digital-based platform, but also the population. And so that is at the top of my mind as I have so many conversations with NIH, who they follow an experimental therapeutic framework in NIMH. But yes. So also, like, along that lines, I would ideally want to partner too with clinicians that have worked in various settings, especially community settings, and how that shows up in their work as well. And then also being open to the fact that maybe it's not the best approach for the population. But therapy can mean a lot of things for a lot of populations. And so keeping that in mind as well. Mm-hmm.
Thank you for the presentation.
Mm-hmm.
I'm curious as to two things. If you might be able to lift up the name of people that are developing interventions where we want to learn and read more, other scholars that we might be able to tap into. And are there, organizations that in your research that you see are doing mental health interventions with Black men in a powerful and useful way that we might be able to sort of look into more? So I just wanted to know researchers or organizations that you discovered that are doing this well.
So that's a great question, as I'm young in the game. So Dr. Daphne Watkins out of University of Michigan, she actually created with her team the Young Black Men Project. I don't know if you guys have heard of it, and I hope I'm not messing up the name, but that is actually one of the first interventions specific for Black male college students that I've heard of. They started on Facebook and then are moving towards Instagram, and so that is definitely one to look at. It's cited somewhere through here, but that's one to check out. And then other people in this space. Ooh, offhand?
Yeah, I don't need.
Hope Lab out in California. I don't remember if it's San Francisco or San Diego because I just can't remember anything anymore. But they're like a social innovation lab where they've done a lot of digital-based work, like mobile apps, like this specific app called IME, IMI. Beautiful app, beautiful web-based platform also for particularly individuals from LGBTQIA+ communities. IME, IMI. Hope Lab is the social innovation lab. They do a lot of work, especially for Black youth, kind of centering Black youth and kind of, actualizing what, the assets they bring and stuff in the mental health work that they do. So for college students, at my postdoc, I was a part of a T32 digital mental health. I was a fellow, and there was this app for college students that IntelliCare for college students. So actually, one of the studies that I mentioned was kind of like an extension of that because we realized that Black males don't know about this app, don't have access to it. Why they might not be accessing it was something important to look at. I'll think of more, and then. Oh yeah, I'll think more.
Thank you so much.
Mm-hmm.
Hi, thanks for your presentation. I was wondering, since DHMI would be on the same platforms as like some other content that could be detrimental to mental health, like specifically like race-based violence and police brutality, how will it combat that, or how will DHMI initiatives combat other harmful forms?
Yeah. So digital mental health interventions are basically, you can access interventions via various technologies. So it won't only sit on social media. Social media will be a delivery mechanism or a tool. Certain interventions are web-based platforms, so they're more controlled. And so if it's, imagine like, this is very like, not at all tested. I'm just making it up right now, but like for like picture purposes. So imagine you are on social media, something happened where you're feeling down or like it's traumatic. and you know that there's this app that you can also access, and so you pop off there and go on there. So it's kind of that, if it's a web-based platform, is separated in that mechanism. But, you know, social media platforms and how I want to use it, still debating between in combination with or in complement with. But I kind of go with the perspective that there's negative stuff on social media, there's negative stuff everywhere. We got to create positive to combat that. And that's where people are, you know, so it's just as important to create these stuff for the particular space to fight that kind of thing. But digital mental health interventions take the form of various technologies. Well, you know, access at laptop, web-based platforms, within clinical settings with doctors, whatever digital platforms they may be using. So there is times where it may be completely separate from the negative, but it might need to be where the negative is to combat the negative. Does that answer your question?
Yes, it does. Thank you so much for the presentation.
Mm-hmm.
I was just curious to know if you have any insights on what types of content this group is seeking out. I know that there was a slide on YouTube being particularly helpful. Like, do you have a sense of, is it advice or content or what they would?
That is a good question. So based on the studies that I've done, things that they want to see, like I mentioned, is more psychoeducation based. So information about what mental health looks like among Black populations so they can recognize it themselves. Video testimonials from Black men who have engaged in certain behaviors that were impacted by their mental health or that impacted their mental health, how they got through this support, what support they had, how they got through it. They want to see visuals that are lifting up Black men, celebrating Black men who are talking about their issues with mental health, how to get around it, how to deal with it, some things like that. Mm-hmm. And then some things that you would think are trivial but very important, like, you know, we know how we feel sometimes. Well, at least for me, if I'm looking at something outdated or not updated, I'm not messing with it. So it's things like that too, like the physical attributes, what aesthetics we need to include, what colors potentially, things like that. And so, mm-hmm.
We have time for one more question, or half a question. Yeah, go ahead.
I'm just wondering if you have a sense, informally even, how the work that you did really benefited your participants. Like, I could see this being a really transformational and positive process for them, where they choose to engage in social media or even their relationships a little bit differently.
Mm-hmm.
Did you have a sense of that through your work?
So, yes. I think the biggest thing was their interest, one. So outside of getting over the shock when they pop up on Zoom and I'm a Black woman, they're like, oh my God. But like, you know, they're very interested in like, okay, what are you using this information with? What are you going to do with it? We want to know, kind of thing. And then the focus groups I would have participants come up to me afterward. One, just, you know, for thanking me for creating this opportunity for them to talk about their mental health experiences. And so it's just a reaffirmation, because there's a lot of myths, whatever you want to call it, where people think that Black men don't want support. They don't want to engage with support. And in fact, that's the complete opposite. So they do want to engage with the support. They just want stuff that is available to them. So informally, yes. But also in one of the last studies I mentioned, like, you know, if you went to look at the transcripts, there would be things like, you know, yeah, you know, we want this, you know, but this is exactly how it needs to look like. How many times we want to be notified, and like there's no hesitancy, you know, there's no lack of interest. I mean, people are taking their lives, you know, people are, you know, down bad, going with untreated mental health issues for periods of time. So they want to know more about it among the population. They want to know how it's manifested in other Black men. So yeah. Mm-hmm.
Great. All right. Thank you so much.
Thank you, guys.
Thanks for making the time. Thank you. And thanks everyone, and the people on the Zoom. Thanks for sharing.
Thank you, everyone on Zoom.